As far as treatment is concerned, treatment of cirrhosis of liver is complex. Why I said complex? Because it all depends on the stage at which the patient is presenting to you. If the patient is presenting to you at the early stage, child A we call it as early stage, then the treatment is based on the reasons for developing liver disease. We need to treat accordingly. So if alcohol is the liver disease and is presenting in early stage, we first control the abstinence of alcohol, because we want patient not to take alcohol. And apart from that, we have some medication which helps in reversing the further damage. Whatever is going to happen because of ongoing alcohol intake can reverse. So if you look at the other etiology like hepatitis B or hepatitis C causing early liver disease or cirrhosis, we can treat by giving antivirals which works against hepatitis B or C. Similarly, in autoimmune liver disease, we can give steroid azathioprine, the drug which works against autoimmune liver disease and further progress the liver disease. But the treatment doesn't depend only on the initial presentation. It also depends on the complication with which the patient comes to you. Identifying the subtle complication in a given cirrhosis of liver is very important part of treatment. Some patients may have early stage but suddenly they deteriorate because of one or other complication which sets in, like portal vein thrombosis, or a fluid which is accumulated in the abdomen gets infected. We call it as spontaneous bacterial peritonitis. So it all depends on what stage the patient comes, and we need to identify the complications of liver disease and treat them parallelly and identify them as well. Once you identify them and treat them, then there is a chance that many cirrhotic patients who come early or in a mid stage can be salvaged and can either delay or avoid further treatment, definitive treatment plan like liver transplantation. Having said so, I don't want to give a message that all patients of cirrhosis of liver can be treated without doing a liver transplant. No, there are few subsets of the patients where liver transplant is a gold standard directly at the outset. What are those? Those are refractory ascites, those who have hepatorenal syndrome, your hepatic encephalopathy, those who have hepatopulmonary or hepatic hydrothorax, those all group of patients, or those who have GI bleeding which is not responding to the medical treatment, like we do banding, esophageal endoscopic variceal bind ligation or systemic therapy with medicine. Those all group of patients we can subject directly to the liver transplantation. Having said so, we need to evaluate the patient before we decide for the transplantation in this group of patients. Now, if you look at some subset of patients where these features are not there, but they can land up in these problems, and if you identify this problem and treat medically, they may be benefited. My message to my patients of cirrhosis of liver, as far as the diet is concerned, is that they should consume less salt. They should have adequate protein. If they don't have a liver coma or liver encephalopathy, they can have a 1 gram per kg body weight as a protein intake per day. They should avoid inadvertent use of proton pump inhibitor, pantoside, omeprazole without doctor's advice. Also, they should avoid the more intake of basically oily food, because if there is a non-alcoholic steatohepatitis, because of high cholesterol and triglyceride, it will again increase. A strict and very diligent control of sugar is very, very important for patients who have diabetes along with the cirrhosis of liver. And also some patients, very few percent of patients who have a cardiac cirrhosis as a cause, where because of the heart problems, right-sided heart failure, you can develop the liver disease, we call it as cardiac cirrhosis. Those patients, they need to be treated with the medications pertaining to heart so that the liver further damage will get arrested. Having said so, this is a vast topic. Cirrhosis itself is a big topic, and there are many things which we come across in our day-to-day practice. I feel that wanted to give you brief information about the cirrhosis of liver and its line of management, symptoms, diagnosis and investigation. Thank you.